Be vigilant about sepsis. Sepsis is one of the most prevalent but misdiagnosed deadly diseases and has been established as a global priority by the World Health Organization. Its high mortality and financial impact have been well described. Despite its significant global impact, awareness of sepsis is still too poor. What is sepsis? From localized insult to cytokine storm, sepsis represents a dysregulated or systemic inflammatory response to pathogens. The host response to an infection starts when innate immune cells, particularly macrophages, recognize and bind to microbial components. The binding of immune cell surface receptors to microbial components activates a host response regulated by both pro-inflammatory and anti-inflammatory mediators. The balance of pro-inflammatory and anti-inflammatory mediators regulates the inflammatory processes, including adherence, chemiotaxis, phagocytosis of invading bacteria, and bacterial killing. Normal immune and physiologic responses eradicate pathogens. However, in the case of an unbalanced pro-inflammatory and anti-inflammatory dysregulated response, the localized process goes out of control and becomes systemic. Local infection, host response, pro-inflammatory mediators, TNF, IL-1, anti-inflammatory mediators, balanced response, eradication of the pathogens, unbalanced response, tissue damage. Excess of pro-inflammatory cytokines released in patients with sepsis may spill into the bloodstream, contributing to the progression of a local infection to sepsis by the following processes: acute phase protein response, induction of IL-6 and IL-8, coagulation activation, fibrinolytic activation, neutrophil degranulation and augmented antigen expression, increased endothelial permeability, stress hormone response, enhanced gluconeogenesis, enhanced lipolysis. When the immune response becomes generalized, cellular injury may occur by altered rate of apoptosis, programmed cell death, tissue ischemia, insufficient oxygen relative to oxygen need, cytopathic injury, direct cell injury by pro-inflammatory mediators and/or other products of inflammation. The cellular injury described can progress to organ dysfunction. No organ system is protected from the consequences of sepsis: cardiovascular, hematological, pulmonary, hepatic, renal, and metabolic. Identifying patients with sepsis early before that cellular injury occurs may improve patient outcomes. If not corrected, cellular injury can lead to organ failure and death. Local infection, sepsis, septic shock, organ failure, death. Early recognition of sepsis. Early and appropriate antibiotic therapy, early and aggressive hemodynamic support, early source control. Be vigilant about sepsis. On Friday, May 26, 2017, the World Health Assembly, the decision-making body of the WHO, made sepsis a global health priority by adopting a resolution to improve, prevent, diagnose, and manage sepsis, adopting sepsis as a global priority. The Global Alliance for Infections in Surgery joins the Global Declaration and its goals. Be vigilant about sepsis. Early recognition, early antibiotics, early hemodynamic support, early SIRS control. Be vigilant about sepsis.